Well, Epilepsy WA is a non-for-profit organisation providing support for West Australians living with epilepsy. Now, Epilepsy WA receives no funding from the government and is actually funded completely by public donation. And I did not know that until tonight. Emma Buitendag is the CEO of Epilepsy WA. She joins me tonight on the night shift. Hi, Emma.
Hi, thanks for having me on.
You are very, very welcome. Now, you've been around since the 1960s. What the heck is this about? Why haven't you been getting government support?
That's right. So we've actually been around since 1963 when we were established by the first female in the upper houses of Parliament in WA. So Ruby Hutchison established Epilepsy WA way back in 1963, and sadly we don't get any government funding, so we do have to work really hard to fundraise. We do some training. We're rolling out a schools program, a very important schools program to help ensure a fair go for children with epilepsy and to support teachers so that they know how best to support a child with epilepsy and that they understand what actions they need to take when they witness a seizure occurring and how they can support that child.
It's not an uncommon ailment. Why isn't it getting as far as you're concerned, the support that it needs financially?
Well, the World Health Organization has previously said that epilepsy is probably the most stigmatised, misunderstood and underfunded of all health conditions. And sadly in WA, that certainly is the case. Every state-based epilepsy association across Australia, two, and we're one of those two, gets funding from their state government, but unfortunately we don't. But we're working really hard and delivering some really quite incredible services to help support the 1 in 25 people that will be diagnosed with epilepsy in their lifetime. And we're working really hard to reduce epilepsy-related harms. Now, a lot of people don't realise this, but unfortunately, epilepsy claims the lives of over 300 Australians each year, and we know that at least half of those deaths are avoidable. So at the core of everything we're doing, we're trying to help support people to better manage their epilepsy and to cope with the impacts of an epilepsy diagnosis. And a diagnosis of epilepsy, it impacts the entire family, parents.
It certainly does that. Mm.
It really does. And I just wanted to point out that parents of a child with epilepsy will experience PTSD at a rate as high as 1 in 4. A person living with epilepsy will experience depression at a rate as high as 1 in 2. And if their epilepsy isn't under control and they have uncontrolled epilepsy with generalised tonic-clonic seizures, their risk of death could be as high as 1 in 150. So we need to stand together as a community to work to bring epilepsy out of the shadows and to reduce the tremendous human toll, the physical toll and the emotional toll of this condition on the people of WA.
Do you know, I saw my first person having a seizure. That person obviously was living with epilepsy. I would have been about 11, I think, and I was so scared for him and quite traumatised by what I had seen with what happened to this little boy. So I know we wouldn't encourage people to have to live through something like that to get you more funding, but it is a wake-up call I think the government needs. You said that WA and is it South Australia that you don't have government support? Well, why are the other states so more forward-thinking than this?
I live almost every day in a state of confusion. I'm not quite sure, but I'm very hopeful that the future will change for us, that our good work will be seen. And talking of that good work, we actually have the largest display of seizure alert technology in Australia. And we also have the largest display of head protection in WA, and we're located right next door to Charles Gardner Hospital and across the road from Perth Children's Hospital. So neurologists are referring people to us for support, for information.
And you obviously use some of the money that you do raise to help these people with equipment and the like, I take it.
So we actually have Australia's only free bed mat loan program. Now, we actually send right across WA sensor mats out to families in need for them to trial. If they are experiencing a generalised tonic-clonic seizure, then these bed mats are aimed at detecting the seizure and alerting loved ones in the house that a seizure is occurring, so that people can attend to that person and that person can receive appropriate seizure first aid. Now, in terms of seizure first aid, 1 in 10 people will have a seizure, and it always astounds me that we don't talk about seizure first aid like we should. Every household in WA should be seizure smart and should know about seizure first aid. And actually, there's around 40 different seizure types, but every household should know how to respond and how to support someone who has a tonic-clonic seizure, or indeed some of the other more common seizure types.
I can imagine these seizure alert bed mats must be extremely popular because parents probably can't sleep knowing that they could be sleeping through their child going through a potentially life-threatening event.
It's really heartbreaking. We certainly have many families in WA who share the same bed as their child in fear of what might happen during the night. We have feedback on our program, on our loans program, that we are helping to save the sanity and the well-being of families. It's a really crucial program. Now, the sad thing is, like our support groups, which of course are very, very crucial as well, you know, that connection with others who are walking a similar journey, it's just invaluable. Now, half of our support groups are actually currently on hold due to the funding situation. Our community's rallying. We had an epic quiz night that was run by some volunteers a few weeks back, and our community is really standing with us. But it is our hope that the government will do the same.
I can imagine that every dollar is precious to an organisation like yours. Any corporate support?
Now, the thing is about epilepsy is we're not a sexy condition, you know. It's not easy to fundraise for epilepsy. People walk by, they don't realise the impact epilepsy has on an entire family, and they don't realise the level of harms. They're not aware of the number of deaths and the number of injuries caused by seizures. So 1 in 10 people with epilepsy will actually experience an injury as a result of a seizure. And, you know, sometimes those injuries are life-threatening.
I did laugh a little there because we have had MND in my family and also MS, and people would say MS Society gets plenty of money because it's the sexy young woman's disease, which is ridiculous. And it's not until you live with something like that that you realise there is absolutely nothing sexy about it. But as you say, it is something that should draw more attention to it. A quarter of the population, you're saying, has been diagnosed. That's an extraordinary number that I've learnt just by talking to you tonight. So I wish you well in your pursuit for more hard-earned cash. By the sound of it, you have lots of ways that you can spend it, and perhaps we need to knock on the doors of the big corporate big guys and see if perhaps they could send some money your way, because it sounds like you're doing some wonderful work.
Thank you. And look, thank you for helping to bring epilepsy out of the shadows. We really appreciate it.
Emma Buitendag is the CEO of Epilepsy Australia. Thank you so much for being on 6PR tonight, and a Merry Christmas to you.
And to you. Thank you.